Hello, my name is Tamika, and I'm gonna be your nurse. Can you tell me your name and your date of birth?
Monica Lewis, 8/27/76.
All right, and I come to do a GI assessment and your renal assessment. But before we get started, I want to ask you some questions, okay?
Okay.
Do you have any abdominal pain?
No.
All right. Do you have any nausea, vomiting, diarrhea, constipation, or fever?
No.
Do you have any difficulty swallowing?
No.
How often do you have a bowel movement?
Every day.
Have you noticed a change in how your stool looks?
No.
And what color is your stool?
Brown.
Does it have a real foul odor?
No.
All right, we're gonna go ahead and get started with your abdominal assessment. Do you have any questions with me before we get started?
No.
All right, I'm just pull your shirt up just a little bit here, okay? All right, right now I'm just taking a look at your stomach. I see minimal stretch marks. Your stomach is rounded. It's full around the umbilicus. I see pulsation around this area, epigastric area. I'm gonna go ahead and listen for bowel sounds. And I'm listening at all 4 quadrants. All right. And what I'm listening for is normal bowel sounds. And while I'm listening, I'm going to go ahead and listen to your vascular system, but I'm going to listen with the bell of my stethoscope. And what I'm listening for is any bruise, and that would be a swishing sound. And I'll start here with the aortic artery. Don't hear anything there. Move down to your renal arteries. Listen on both sides. Then I'll move down to the iliac artery. Also listen on both sides. And I don't hear any bruise, and I hear normal bowel sounds. So what I'm going to do now is I'm going to lightly palpate just to see if I'm going to feel any masses, tumors, tenderness. So we'll start here. Any tenderness up in here?
No.
What about over here?
No.
What about here?
No.
What about here?
No.
All right, what I'm going to go a little bit deeper just to see if I can feel any tumors on your inner surfaces. Any pain?
No.
Pain?
No. No.
All right, and what I want you to take a deep breath. I'm going to press here. And then let it out. Does the pain, if you have any pain, does it stop when you let out?
No.
All right, normally if there was pain there, that could mean that there's a inflamed gallbladder. So now, what about when I press here? Does it-
No.
all right, and this is your McBurney's point, and this, if there was pain here, it would be positive for maybe appendicitis. All right, another test that I'm going to do to check for appendicitis, can you try to lift your leg up and lift it up, don't let me push it down. Do you feel any pain in your lower quadrant here?
No.
All right, if there was, that's another sign that would test for appendicitis. One other test is the obturator muscle. What I'm going to do is I'm going to flex it inward. Do you have any pain in your
No.
right lower quadrant? No? Like I said, again, that's a positive sign for appendicitis. One other test that I'm going to do is I'm going to push here in your left lower quadrant. If there's pain over here, that's another way to test for appendicitis. Any pain?
No.
All right. Well, that completes the test for the abdominal assessment. Now we're going to move on to the urinary assessment. I'm going to ask you some questions before we move on to the urinary system. Do you have any difficulty passing urine?
No.
How often do you urinate?
Every day.
I mean, I know you. Is it Every 5 minutes, every 10 minutes, about every other hour?
Every other hour.
Okay. Do you have to get up at night and use the bathroom often?
No.
How much urine do you normally pass at a time?
60 milliliters.
Okay. Is there any pain or burning?
No.
Do you ever feel rushed to get to the toilet?
No.
Do you ever leak urine or wet yourself unintentionally?
No.
Can you sense when your bladder is full or when you've already voided?
Yes.
All right. Does a sudden coughing, sneezing, or laughing cause loss of urine?
No.
All right. Well, to test for your kidneys, because we can't really feel your kidneys, I want you to sit up, and I'm going to test for any pain or tenderness, if you turn this way, at your costovertebral angle. And I'm going to test on both sides. And what I'm going to do is just percuss on both of those angles, okay? Tell me if you feel any pain or tenderness.
No.
What about on this side?
No.
All right, well, that concludes our assessment. Do you have any questions for me?
No.
All right, well, the doctor should be in shortly.
Thank you.
Thank you.